People think about lip filler, they think of these ducky, big, overfilled lips, but that's not really what lip filler is. That's bad lip filler. Hi, I'm Noreen Bollinger, nurse injector at AesthetiCare, a world's leading clinic. So what is lip filler? Lip filler is hyaluronic acid, and again, hyaluronic acid we make in our body. It's actually a sugar compound that loves water. So the gel, which is the hyaluronic acid gel lip filler, is actually mimicking what we make in our body. Since it loves water, it gives this beautiful plumping effect to the lip. Some of the gels are a little more plumping, love water a little more, and some are really subtle and natural. Some people's lips, the more mature lip that don't want to look like they've had lip filler, be very soft, very natural, create some volume, some of the crepiness, make that go away and give some nice borders to the lip. That's going to be your soft filler. Then you have younger people that want that nice voluptuous lip and can handle the volume. So we would use a product that's going to pull in more water and make that lip just a little bit juicier. In my opinion, lip filler should be natural. I tell people no all the time. If you come in and your lips are beautiful and you've had filler in the last year and you want more, I go back and I look at your pictures from where you started and where you're at now. If a lot of that volume has went down, I would maybe put some more filler in. If you have not seen any change from when you've had it done, then I would not give you more lip filler. In my opinion, it should be so soft, so natural. We're not trying to change the shape of your lip. We're trying to enhance the beautiful, natural shape that you already have. That's the problem, in my opinion, with lip filler when it looks unnatural. They're trying to get the shape that is not theirs. And so with lip filler, we're gonna take some of that volume, put it into the lip, the body of the lip, the pink of the lip, and then we can also enhance the border. So where do I inject lip filler? Lip filler is really customized patient per patient. So the first thing I look at is the crepiness of the lip or the lip tissue. Some lips are really dehydrated and there's a lot of crepey tissue, and some are not. Then the next thing I'll look at is the border of the lip. Is there a nice crisp border, or has the border of the lip kind of been lost with time of aging? The next thing I'll look at is the shape. So if somebody has a very thin lip, barely any pink show, I know in my head that I've already got to grab a very thin filler that is not going to be too much volume for that lip. The next thing I'll look at is what's around the lip. So I'm not just looking at the lip, I'm looking at the oral commissures at the corners of the mouth. I'm also looking at the marionette lines, as well as the perioral lines or the smoker's lines above their lip. And so if a client comes in and they want lip filler, but they have all these lines up here and the corners of their mouth are downturned, and I just give them lip filler, they are gonna be so unhappy. So I wanna look at your lips and I wanna see this whole area as one. So many times I'll establish the corners of the mouth and treat some of the perioral lines at the exact same time as I'm treating the actual lip. And again, less is more. I'll do some volume in the lip. I'll let you see and see what you're thinking about the volume. And then at that time, we can proceed and do a little more, or we can stop there. Some clients, I'll even have them come back in 2 weeks and then see if they want a little bit more lip filler. So really stacking that filler slowly is really appropriate so we get a nice natural lip that's not overdone. So what to expect with lip filler. So you'll always have a consultation, and many times we've done that consultation when you're in for your tox treatment or in for your laser treatment, and we can talk about the goals that you want for your lips and then what I think is appropriate for you. And you're going to come off any blood thinners to help reduce bruising and swelling, and so come off any fish oil, aspirin, ibuprofen. If you get cold sores, I will also want you to pre-medicate with some acyclovir Valtrax just to make sure that you don't pop up with a cold sore after you get your lip filler. The day that you get your lip filler, you're going to come in. We will do photos. Photos are essential. Photos at rest, and then photos without an animation. So I'll have you smile, I'll have you pucker, so we can really see what the shape and structure of your lips are doing. Then I will put a topical numbing on. I will let you set for 10 or 15 minutes. Lips are the most sensitive area on the face. Lots of nerve endings with the lips, which is why people kiss, because it feels better, it feels good. And so I'll let you sit with topical numbing. You can always have a dental block. Some of my patients that are very, very sensitive that otherwise would not do lip filler, we can always do that as well. Most people do fine with the topical numbing. Once you're numb, nice and numb, I'll clean your face and we'll start the procedure. Many times I will treat the areas around the mouth first. I will treat the corners of the mouth, turn those up, give you a happy smile, treat any of the perioral lines, and then I'll jump right into the lip, giving shape to the vermilion border and the little cupid's bow, making sure you have that nice little heart shape to your lip, and then I'll treat the body last. Sometimes I'll treat these little columns here that kind of travel up from the nose to the top of the lip, depending on the person and depending on how you present. So the whole procedure takes about, with numbing, maybe about 40 minutes. When you're done, you are gonna feel like your lips are nice and plump and you're gonna have some swelling. The next day when you wake up, they're actually gonna be the most swollen. Many people kind of freak out a little bit. It's completely normal. And so you're gonna ice. So the day you get it done, you're gonna ice. The next day you may ice a little bit. Antihistamines are great. Zyrtec or Benadryl, something like that can help as well. You're gonna avoid the makeup the entire first day. The next day you can wear makeup. The most significant swelling is that next day, and then each day from there, a little bit of that is gonna go down. Within 2 weeks, your lips are gonna be healed and beautiful, but you do have to give it time to really heal and let that swelling go down. So you have to plan it at a time in your calendar that you don't have any big events, because you don't wanna have any bruising or swelling and have a big wedding or something like that. The filler typically lasts about a year. And that is, a general rule of thumb. That's what the studies show. But some people's lip filler lasts much longer than that. Again, some people's lip filler burns through it much quicker. And so those people that hold on to their filler in their lips, I say they are lucky people. And the people that burn through their lip filler are not as lucky. So you can expect about a year, and then you're gonna follow up and we'll take your pictures and see how much is there and then how much is gone. And the next time we may do a half syringe or what is best for you, because one size does not fit all. The lip filler can be so beautiful and so natural if it's done by the right provider and they give you the proper consultation and assessment. To learn more about lip filler, visit worldsleadingclinics.com.